Hello, my name is Michael Hernandez, and in this video, I will be sharing with you my conflict resolution plan for a potential conflict situation that could potentially be a barrier in implementing my quality improvement project. This quality improvement project was based on a needs assessment that I completed particular to my unit and my hospital on a larger scale. To briefly summarize, the gap identified in my needs assessment, particular to my workplace, is focused on medication reconciliation. Medication reconciliation is a huge aspect of patient care, and there are many moving pieces in which errors can occur. For the purpose of my particular project, I will be focused on the errors of omission. Omission of patient home medications can be detrimental to the patient and can lead to adverse patient outcomes. Particularly on our night shift admissions, it can be difficult to contact family or whoever is responsible for the medication list to update into our hospital records. If the information from night shift regarding incomplete medication reconciliation is not relayed to the day shift nurse, or the day shift nurse is not proactive about obtaining the list, the patient can miss their home medications for many days, leading to an adverse patient outcome. After briefly speaking to my manager about my project idea, she did mention that she also noticed the gap may mostly lie in those late night shift admissions. My proposed solution is to implement an alert in the electronic health record that will populate on the nurse's screen that the medication reconciliation has not been completed. In our EHR, important tasks that have not been completed will populate red in color with an exclamation point indicating that this item is high alert. One example of this that's already in process is patients who may have sepsis. The system identifies data points in patient vital signs and triggers important alerts in which the nurse is to complete documentation that the sepsis alert has been addressed and the physician has been notified. I would like to implement something similar to this, but for medication reconciliation and have some brief documentation for the nurse. For example, the alert can populate if it has been 24 hours and the patient's medications still aren't reconciled. The goal of implementing this alert is to decrease medication reconciliation errors of omission, which will ultimately result in decreased adverse patient events. Overall, it will result in better patient outcomes throughout the patient's hospital stay. The main potential conflict that I am anticipating is that the staff nurses on my unit will not buy into the proposed change and push back against the idea. This would be a barrier to successfully implementing my quality improvement project since their buy-in is the only way that the project could work in real time. In a current work climate where many nurses are already burned out and overloaded with so many tasks, it is easy to see why they would push back. Giving them yet another task to complete may seem impossible on a busy shift and on days when the hospital is already short-staffed. Without the buy-in of the bedside nurses, they may not comply with the change, which would effectively render this quality improvement project useless. The staff nurses are the key stakeholder that are being focused on for this particular conflict resolution plan. However, other stakeholders involved in this project would include the leadership or management team, medical staff, pharmacy, and information technology team. The proposed resolution plan is to hold a staff meeting regarding the changes to be rolled out on the unit. I, as the project leader, will present this idea to my peers as an equal, rather than having our managers relay this information. I am not in a management role, which shows my team that I will be doing the new task as well, and have bought into the idea that it is good for the team and for the outcomes of our patients. I will give an explanation in the meeting regarding the medication reconciliation alert and flow sheet to be documented on. In order to increase the buy-in of my fellow staff nurses, they will need to get some deeper insight as to why we are doing this additional task. If they can understand the rationale for doing it, there will be increased buy-in and compliance. One idea to drive the rationale home is to present some real scenarios that have happened as a result of patients' home medications not being restarted and the adverse events that were directly attributed to omission of medication reconciliation. I will select about 2 or 3 scenarios to the team and explain that these events actually occurred and can easily happen again while any one of the staff nurses are on shift. This will drive home the idea that the task is critical for patient safety. The change will improve patient outcomes regardless of what the patient was admitted for. I will serve my fellow staff nurses as the unit medication reconciliation champion and will offer myself to assist or help anyone with medication reconciliation on an as-needed basis. The theoretical model that will be utilized is the interest-based relational approach, or IBR. The entire conflict resolution plan will be viewed through the lens of this theoretical model. This model is key to respecting individual differences while also helping people to avoid becoming too entrenched in a fixed position. The use of a theoretical model is important, as studies have shown that knowledge of implementation science can help clinicians adopt high-quality evidence into their practices. The interest-based relational approach model utilizes some rules that are to be followed. The first one being to make sure that good relationships are the first priority. And I think myself as the project leader would be good to fit in that role because I've established so many relationships with my peers, and I feel like they would definitely listen to what I have to say and take it into consideration. Number two is to keep people and problems separate. So we don't want to point the blame at anybody saying who's doing the medrec and who's not. We're going to be focused on the problem as a whole, and we're not here to blame anybody. Number three, we want to pay attention to the interests that are being presented. So in the meeting, we want to hear other people's viewpoints. Maybe they have a point of view that I hadn't taken into consideration. So number four being listen first and talk second. So after presenting your information, take some time to listen to the team and see what their input is. Number five is being set out the facts. So what are we trying to achieve with this improvement? And how are we going to go about this? Number six, explore options together. Again, listen to the input of the team and see if there's any good ideas out there that can also be implemented. Number seven, practice reflection when you communicate. So definitely think before you speak. Number eight, make your point directly and concretely, so don't ramble, get straight to the point. Number nine, keep your voice tone neutral and remain calm. And never threaten an individual with a specific consequence, and don't get emotionally involved in a confrontation during the conflict. And do not swear or behave inappropriately. Some of the 7 principles of conflict resolution will be utilized within this conflict resolution plan. The first principle being utilized is acknowledge the conflict. I will directly address the potential conflict of nurses not buying into the proposed change and lack of compliance. I will acknowledge that nurses already have so many tasks to complete as is, and that shifts can get extremely busy and chaotic, as I too work the bedside. By doing this, the team knows that I have an understanding of what it is like to be in their shoes, rather than it coming from the top down and the changes coming from someone who has no idea what it is like to be a nurse at the bedside. I will follow up with explaining why the task is necessary for patient safety and reducing adverse patient outcomes. Principle 2 is to take control, building resolution-focused conversations. I will take control and use the principle by asking for input from the team that is geared towards creating a resolution rather than finger-pointing. I would like to hear ideas from the team to come to a resolution to the issue, as maybe there's another dimension to the problem that I did not consider. Involving my team in the conversation regarding the change and making them feel involved in it would increase the likelihood of them adopting the change. Evidence suggests that engaging stakeholders in decision-making, the generation of shared values or goals, and the change process itself leads to increased success in implementing change. Principle 3 is to construct a resolution with the conflict resolution framework. As I mentioned before, I would be utilizing the interest-based relational approach as the framework for this project. Principle 4 is to enable other success. This principle will be implemented by offering myself to my unit as the subject matter expert on medication reconciliation and assist the team as needed with MedRec. Principle 6 is to walk the walk. I will continue to work in my role as a bedside nurse and take care of patients, so I will need to set the example in my own work in regards to making sure that I hold myself to the same standards as the rest of the team. This concludes my conflict resolution plan, and thank you for listening, and I look forward to hearing your feedback. Thank you.